Confusion over new CDC guidelines on coronavirus testing. They suggest that people without symptoms don't need to be tested. That's even if they've been in close contact with an infected person. It's a flip-flop on past guidelines that said people with exposure to COVID-19 should be tested even if they're asymptomatic. KPIX 5's Andria Borba on the local health officials who are baffled by the new guidelines, and they are certainly not the only ones. Andria?
Well, across the board around here in California, local public health officials have called these new CDC recommendations anything from bizarre to appalling. A steady stream of people driving in and walking up to the testing site on the Embarcadero are anxious to know whether they've been exposed to COVID-19. But in a dramatic change, new guidelines from the CDC are raising questions about who should be tested. The federal government is no longer recommending testing for people who show no symptoms, but were within 6 feet of a positive case. Local health directors were blown away by the recommended changes.
That when I first heard about this change in guidelines, I actually didn't believe it, for it seemed entirely bizarre, in that it undercuts our very basic tenets of how we control an infectious disease.
Governor Gavin Newsom says federal testing policy will not change how things are done in the Golden State.
We will not be influenced by that change. We're influenced by those that are experts in the field that feel very differently. And so with respect to the CDC, no, that is not the policy guideline that we will embrace or adopt here in the state of California.
UC Berkeley clinical professor Dr. John Swartzberg calls the new guidance appalling.
It is the wrong direction. Testing is our eyes on this pandemic. Without being able to see what this virus is doing in the human population, we don't know what to do to control it.
Dr. Cody bluntly says to get rid of Zoom schooling, more swabbing is needed.
That is how we are going to get our children back in the classroom where they can best learn. It's through testing. It's through knowing your status. It's absolutely foundational.
Andrea, the change in the guidelines came down in an unusual way, to say the least. Several news outlets reporting it may be the result of political pressure.
That's right, Alan. This was not a decision the CDC made in a vacuum. There are multiple reports now, including confirmation from Admiral Brett Giroir, that this came from the Department of Health and Human Services, and even above that, this all happened while Dr. Anthony Fauci was in surgery under general anesthesia.
All right, Andria Borba in San Francisco.